that they could easily contract HIV and AIDS because of lack of awareness, and also get unwanted teenage pregnancies because of lack of knowledge on sexual reproductive health.
So it also set us thinking. We didn't even see any players trying to target this group of people. For example, for some of the schools we were visiting, schools say of the School of the Blind, schools of the Deaf, some of the young people interacted with, they expressed an interest. They showed a desire to have this information delivered to them. But the format that we had was not suitable to what they needed. And that is where we started with our Braille.
But if you look at some of their magazines, you'll actually see testimonies of young children, young adolescents with disabilities, able to talk about the issues of sexual reproductive health and HIV and AIDS, like their non-disabled counterparts.
Whenever they read the papers, they come and ask you questions. Then we try to interpret to them what the question means, what the information means to them. And it has really helped them to learn a lot about health education. Sometimes they ask you questions, what brings about these changes we have in our bodies? How does AIDS spread? And they can ask, can even a younger kid get the HIV AIDS?
But then people have different things.
Straight Talk recruited a sign language interpreter at Gulu Youth Center with the aim of breaking communication barriers with persons with disabilities who were seeking services.
Which led to a very tremendous achievement of congregating so many young people with hearing challenges, both deaf and hard of hearing, to come for services. Because at that point then, because there was a sign language interpreter, the services of Gulu Youth Center were accessible.
If you realize there are very few sign language interpreters, there are very few friendly health workers out there who are patient enough to work with the disabled persons.
This meant that Straight Talk had to reach out people with disabilities at location, coming, of course, at great operational costs.
So rather than having young people with disability trying to find their way to our youth centers, we have also decided to extend this service directly to their homes.
As much as Straight Talk over the years has tried to support the special needs work, not so many partners and donors have come up actually to support special needs. There's need for a lot of advocacy to support the special needs work that Straight Talk has embarked on.
And also a new area for us that we've worked on for the past 7-8 years has been also addressing post-conflict areas.
Reacting to the sensitivities of the youth in this region, youth-friendly centers such as this one in Kitgum were established, offering sexual and reproductive health services to the youth. Coming, of course, in the heels of its predecessor, Gulu Youth Center. Today, there are 5 youth centers with Ajumani, Moyo and Moroto centers included. Peer-to-peer engagements, counseling and testing, and condom usage. These are some of the services available at these centers. In addition, there's a gender-based violence response and case management unit at Gulu Youth Center, where survivors from the districts of Gulu, Noya and Amuru are supported, and referrals, both medical and legal, are made. Another unique service up northern Uganda is a service known as moonlight testing. This, considering the sensitivities surrounding HCT services in this region, is done in the cover of darkness. The coy and the shy feel confident enough to come out and test, and the numbers, as with this one night of filming, are impressive. The work of Straight Talk in Karamoja is through partnership with UNICEF under what's known as the Sports for Life program.
The Sports for Life program basically is tied to the education program and is targeting sports activities in schools.
Sports for Life essentially enables us to use unique approaches such as the use of sports to mobilize communities to get information on development.
Because of terrain difficulties and access to health services, women of childbearing age have barely seen any immunization, hence the rampant neonatal tetanus in this region.
We have been taking opportunity of every school events like sports and others. We mobilize our health workers who go to the sites of these events and carry out the exercise. And the turn-up has been so good and very impressive. 40% of the population in Napak lives in a radius beyond 10 kilometers from the nearest health facility. And really that is one thing that also influences access to services.
We were getting problems with the transport to reach there, and also the community there are suffering because there is no health facility around. So we appreciate their work because of that.
People come to access these services. So the role of Straight Talk Foundation has been around communication, right? Mobilizing communities to bring their children for immunization. Okay, pregnant women to come for immunization as well, and also the men, their partners, okay, to make sure that they also come, they also facilitate the women and children to come to access these immunization services.
Straight Talk trained approximately 25 youth, equipping them with journalistic skills to enable them conduct dialogues and improve visibility of the Sports for Life program.
Our topics, most of the topics are about health and education. We normally go to the communities, sub-counties, villages to teach people about the importance of education and about health.
The trained journalists work in villages facilitating community dialogues, thus giving the community vital information.
And we are mainly agents for change to transform communities. Our main work also, we do what we call community radio. We go and take the radio to the community, and it's the radio by the community for themselves, for them to raise out their issues and their issues be heard.
Illiteracy rates here are so high. So even sometimes when you have to pass the message, you really have to package it well in a language that is simplified down to earth in order to make these young people who have previously been warriors, make them appreciate the existence of the problem. And that's the big challenge we have. But I'm happy to report that with the intervention of programs like Straight Talk Foundation, Restless Development, which are targeting youth, there is some light at the end of the tunnel.
The Livelihoods and Environment Department is the youngest department of Straight Talk Foundation. We are not 20 years as the mainstream Straight Talk is, we are only 10 years. We work mainly on tree growing and introducing agriculture at schools and at community level. Around 2002, when we started, we were running as a newspaper called the Tree Talk, and later started another one called Farm Talk. And these have been running up till today and are distributed countrywide. Then we started distributing tree seed with the manuals that guided people on how to start small nurseries. And these went across the country, and consequently over 7,000 small-scale nurseries sprang up across the country. And we are proud that these initiatives have contributed to the restoration of the forest cover in this country. We are now in 2 communities. We are working with communities, we are working with prisons, we are working with the institutions. But still, the schools are our major entry point.
Because when we have started planting the trees in our schools, the community around, have a look at it, they were also interested in planting those trees in their homes. And they went to the tree talk nursery beds. They requested for it, and many have already planted it in their places.
Shortly after the war, we attracted funding as everybody was moving up in the north. We attracted funding from the United States funded wildlife conservation for landscapes and development within the northern Uganda region. We also further attracted funding from the Danish embassy to improve the quality of life of the people as they went out of war. When these people were leaving the internally displaced people's camps, they were going back to their homes, and in their homes they needed new forms of assets, livelihood assets, and we thought giving them investment in tree planting was an initiative that would be highly appreciated and would change their quality of life in a short period of time.
Because we believe once they have their livelihoods addressed, they're able to actually address their own health needs.
Those who've been at Straight Talk agree that it's been a great learning center.
This job has really helped me also to learn a number of things and appreciate the different types, cultures, and the backgrounds of different people. I've been able to meet a number of young people, old people, young parents, and I've been also able to learn a number of things, mostly how to handle adolescents.
So what's the way forward for Straight Talk towards the next 10 years?
Going ahead for the next 5 years in our new strategic plan, innovation is the catchphrase. And also looking ahead, we want to see an organization also positioned as a learning center for many partners locally, but also globally.
We can only look forward to a very exciting interface between all these key actors in a bid to fight the HIV/AIDS pandemic, in a bid to empower the young people so that they are able to grow and realize their ambitions in life.
You know, I think supporting communication for social change, which is what Straight Talk does, is absolutely essential, whether it's about HIV, whether it's about staying in school, growing trees, protecting the environment, stopping cattle raiding. You need communication for social change, and that's what Straight Talk does so beautifully through radio and print and face-to-face communication.
They have to be aware of the context of the young people and the culture of the young people and continue to address HIV prevention, reproductive health issues, environmental issues using the context of these young people. And I think if they do that, they'll continue to be a relevant organization.
Urenduru